This is Dr. Ishita Majumdar, consultant cardiologist and practicing in Asansol in Mission Neighborhood. So today I'm going to talk about ABPM. What is ABPM? It is ambulatory BP monitoring, which provides a 24-hour account of the patient's state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and mask subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. BP level measurements using home or ambulatory BP monitoring is recommended in patients with office BP classified as high normal BP or grade 1 hypertension. So many patients who come to the office OPDs and say that while I come to your OPD, I have hypertension, otherwise I don't have. So to diagnose all these things, we have to monitor with ABPM. ABPM provides an average of BP readings over a defined period, usually 24 hours. The device is typically programmed to record BP at 15 to 30 minutes interval. At average BP values are usually provided for daytime, nighttime, and 24 hours. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable BP recordings are required for a valid ABPM measurement. ABPM values are on average lower than office BP values, and the diagnostic threshold for hypertension is more than equal to 130 by 80 millimeter of mercury over 24 hours, more than equal to 135 by 85 millimeter mercury for the daytime average, and more than equal to 120 by 70 for the nighttime average. All are equivalent to the office BP, which is being measured more than equal to 140 by 90 millimeter of mercury. So what are the advantages of ABPM? It is a better predictor of hypertension-mediated organ damage than office BP because it is the fluctuation of the BP which denotes or interprets the organ damage. 24-hour ambulatory BP mean has been consistently shown to have a closer relationship with morbid or fatal events, more sensitive risk predictor than office BP of CV outcomes such as coronary comorbid or fatal events and stroke, can identify white coat and masked hypertension, stronger prognostic evidence, nighttime readings are available, measurement in real life settings, additional prognostic BP phenotypes can be identified. Abundant information from a single measurement session, including short-term BP variability. So what are the disadvantages? It is an expensive and sometimes limited availability. It couldn't be used, can be uncomfortable as it has to be worn throughout the day. ABPM has become an indispensable tool in the diagnosis and management and its therapy. Guidelines from ESC recommend that diagnosis hypertension should be based on repeat office BP measurements or ABPM if economically feasible. Analysis of various indices on the ABPM graph, such as the Hierarchic Index, Diurnal Index, dipping, and other indices can provide useful information about the prognosis of disease such as hypertension, diabetes mellitus, CKD, and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ABPM is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help direct the treatment in such patients when required. Overall, ABPM readings can guide towards the prognosis of underlying organ damage and can be a useful predictor of cardiovascular risk. Thank you.